Hi everyone, in this video we will be learning about robotic surgery. So friends, first I will introduce the topic, then we will be learning its types, then its advantages and disadvantages, followed by lastly conclusion. So friends, this is what we will be learning. It is basically this which will be introduced. It's robotic surgery, and first here it's computer console. Here the surgeon sits, then it is the camera view through which he views the patient and how the surgery is done. This is the high definition 3D camera. Here is the patient. This is the surgical cart with robotic hands which is doing the surgery for and this is the nurse. Now, introduction. Robots are used in operating room to assist the surgeon in performing surgery. The surgeon views patient via visual terminal. So how he views? By visual terminal, and manipulates robotic surgical instruments via control panel. Use of operative area transmitted from the cameras. How? From the cameras inserted into the body. Robotic surgery systems are still relatively uncommon. These systems have potential to improve the safety and effectiveness of surgeries. Three major advances aided by surgical robots are remote surgery, minimally invasive surgery, and unmanned surgery. Remote surgery. It is also called as telesurgery. It is the ability for a doctor to perform surgery on a patient even though they are not physically in the same location. It is a form of telepresence. A robot surgical system consists of one or more arms, a master controller, and a sensory system giving feedback to the user. Minimally invasive surgery. It is a surgery which is done using small incisions and or cuts and few stitches. During minimally invasive surgery, one or more small incisions may be made in the body. A laparoscope or a thin tube-like instrument with a light and a lens for viewing is inserted through one opening to guide the surgery. Tiny surgical instruments are inserted through other openings to the surgery. Minimally invasive surgery may cause less pain, scarring, and damage to healthy tissue, and the patient may have a faster recovery than with traditional surgery. Unmanned surgery. It is a type of surgical procedure which is done using robotic systems. It was developed to try to overcome the limitations of pre-existing minimally invasive surgical procedures and to enhance the capabilities of surgeons performing open surgery. Now, types of uh, types of robotic surgery. For like these are the types. First, supervisory controlled robotic surgery system. This telesurgical system is Da Vinci surgical system. Next, ZEUS robotic surgery system. Fifth, automated endoscopic system for optical position is AESOP robotic surgery system, which is abbreviation for this system. Shared control robotic surgery system, and seven, cyber knife system. So how many types? There are seven types. First is supervisory control robotic surgery system. Second, telesurgical system. Third, Da Vinci surgical system. Fourth, ZEUS robotic surgery system. Fifth, automated endoscopic system for optical position, which is AESOP abbreviation for this robotic surgery system. Shared control robotic surgery systems, and cyber knife system. So in total, there are seven types of robotic surgery. Supervisory control robotic surgery system. It is the most automated system. Specific set of instructions are required. Robot programming. Mapping of patient is done in three ways: planning, registration, and navigation. So this is basically the supervisory control robotic system. Like here, it is the computer terminal. Here the surgeon sits. Surgeon plans the surgery offline on a computer model of the patient, such as like CT, MRI scans. Then the surgeon downloads the surgical plan to the surgical robot. It is the surgical robot. The robot executes the downloaded surgical plan while surgeon observes and supervises the surgical robot system. Now next, telesurgical system. It is also called remote surgery. Surgery is performed by a robotic system controlled by surgeon at distance site. Advantages: assisting and training surgeons in developing countries, collaborating and mentoring during surgery by surgeons around the globe. Now it is the robotic telesurgery. Just a minute. Here is the surgeon. This is the real-time image from surgical scene. Haptic interface. It is haptic interface. Surgeon controls the robot online. Force feedback from surgical instruments. Here is the surgical robot, and here is the patient. So surgeon controls the robot. If we have to explain it in 3 to 4 lines, we can explain it like surgeon controls the robot in real time through the haptic interface. Robot faithfully replicates the surgeon's motions with the interface. Master slave surgeon gets real-time feedback from surgical scene via the camera and the force feedback from the instruments. Now, next is the VINCI surgical system. It is the first FDA approved robotic system in American operating rooms. It provides 7 degrees of freedom in instruments. Surgeon directs motion of robots. Its components are: first, viewing and controlling console; second, surgical arm unit, which is forearms. Its uses: prostate cancer surgery; second, hysterectomy, an operation which is used to remove the uterus; it's now mitral valve repair and thoracic surgical procedures. Now this is the VINCI surgical system. The VINCI surgical system. Now next is ZEUS robotic surgery system. It is made up of ergonomic surgical control console and 3 table-mounted robotic arms. Voice control and touchscreen interfaces with 2 monitors are used in surgical control console. It is used in microsurgical tasks and in endoscopic surgery. You must be knowing endoscopic surgery, in which the doctor uses a mirror which is put inside the esophagus, or which is the food pipe, and the internal part of the intestine is seen uh, in that. Now this is basically that only. ZEUS robotic surgery system. Now is AESOP robotic surgery system. End effector and endoscope coupled to a robotic arm assembly which moves endoscope relative to patient. System includes: first, computer. It controls movement of the robotic arm. Second, cart. Spring loaded mount plate. It allows the robotic arm to rotate and adjust relative to cart and patient. And this is the AESOP robotic surgery system. Now is shared control robotic surgery system. Robotic system monitors the surgeon's performance and provides stability and support through active constraint. The surgeons must first go with planning, registration, and navigation phases with operative area. A robot can offer guidance only after inputting the information into robot system. It minimizes soft tissue damage. If instrument enters soft tissue boundary region, robot will offer resistance indicating the surgeon should move away from that area. If the surgeon continues cutting towards soft tissue, robot locks into the plan. Looks in, shared control system like here the surgeon, surgical robot, patient, robot and surgeon remain jointly in control. The surgeon remains in control of the procedure while the robot provides a steady hand manipulation of the instrument. Now the last cybernized system, it delivers multiple beams of radiation to the tumor. Beams of radiation can be projected in any direction. Prior to procedure, patient is imaged using HRCT scan to determine dimension and location of tumor. Image data is transferred to the cybernized systems workstation. This software is used to calculate required dose and direction of radiation beam. Each treatment session shall last between 30 and 90 minutes. This is the cybernized system. So the robot surgery system like X-ray imaging sources, then the linear accelerator, its collimator changer, its robotic manipulator, its X-ray imaging detectors, its robotic couch, and its optical camera. Now, advantages. First, outer sea mission. So it also has some advantages with it. Like one is outer sea mission. Second is deep sea exploration. Third is polar expeditions. Fourth is dampen tremor using embedded filters. Fifth is free movement of hands. Sixth is less pain bleeding. Seventh, fast recovery, as we have already learned in the starting that the patient has a faster recovery rate. Enhanced precision. Ninth, decreased fatigue of doctors. Not disadvantages. If error is coded to a robot, it may harm human during surgery. Robotic assisted heart surgery can take nearly twice amount of time that a typical heart surgery takes. Robotic systems are very expensive. No tactile sense of tissues. Delayed transmission of data comprises quality of surgery. Because no two patients have exact same body structure, it's impossible to have standard program for robot to follow. Then finally, conclusion. Although in its infancy, robotic surgery has proven value in areas of inaccessible conventional laparoscopic procedures. It has the potential to expand surgical treatment modalities beyond the limits of human ability. Although feasibility has largely been shown, more prospective randomized trials evaluating efficacy and safety must be undertaken. Further research must evaluate cost effectiveness or a true benefit over conventional therapy for robotic surgery to take full root. With this, I've ended my presentation. Friends, if you have liked the video, enjoyed the video, then please like it, share it. Those who haven't, please subscribe my channel, Knowledge Booster. Hit the bell icon and don't forget to comment in the comment box. Friends, I don't want likes or subscribe. I just want shares because I want to spread knowledge to more and more people. So please share my videos so that more people can get education of what I make the videos about. So friends, okay. Bye friends. Stay safe. Take care.